Hey everybody, this is Lee from King Harvest and kingharvest.org. I'm here today with Bridget to ask and answer a couple of questions about migraines, migraine prevention, and if cannabis oil medicines from King Harvest and kingharvest.org would be helpful for treating these kinds of conditions. So let's ask and answer a couple of questions.
Sure. So the first question is, can I use CBD oil to prevent migraines?
Absolutely. CBD oil is very effective on migraines, especially in the prevention. The idea is that we want to lower as much inflammation in the brain as possible. So if we can use CBD, the idea is that CBD, as we all know, is a very powerful anti-inflammatory. So in larger doses, it is a much more powerful anti-inflammatory than something like ibuprofen or different kinds of even pharmaceuticals that the doctor might prescribe you to deal with your migraine. So CBD is very effective because it reduces the overall real estate on the outside of the brain. We reduce brain swelling, and it can prevent and relieve a migraine.
Great. So if someone gets visual auras with their migraines, if they use cannabis oil, will that help prevent their visual auras?
So the visual aura in many cases is one of the first signs of an onset of a migraine. CBD will shrink, as I said, due to the powerful anti-inflammatory compounds. It will shrink the surface area in the brain and on the surface of the brain so that visual disturbances never happen and or they are relieved.
So how does cannabis oil help with migraine-related nausea?
Slightly different mechanism there. CBD is what's responsible for the anti-inflammatory part that's actually improving the migraine situation. THC, depending on the time of day, different types of THC will help you with your nausea and will relieve that symptom as well. So as an example, we would use a full extract CBD medicine to treat the migraine, and then we would use a few doses, a few drops of the unwind product to take to work on the nausea and any pain, any acute pain in the head, that kind of thing.
So if someone's already experiencing a migraine and needs immediate relief, is there a better use than CBD oil to get immediate relief?
Okay, so if you need immediate instant results, the reason why we all used to smoke pot or still vape or do these things is because the cannabinoids will go right through the subcutaneous cannabinoid receptors into the blood-brain barrier and give you that instant relief in seconds. So if you are starting to feel the onset of a migraine, then vaping or smoking can really help. And many of you have seen improvement in your symptoms from that. But if at the same time you take a good-sized dose, appropriate dose of CBD-dominant cannabis oil, that will, the smoking will help you feel better for about an hour, but the oral dose of the oil will keep the inflammation down for the next 4 to 6 hours and will deal with the underlying mechanism that caused it in the first place.
So if someone's having a migraine and they take medication for it and it doesn't work, does that mean the cannabis oil won't work on the migraine, or will it work?
Not at all, because pharmacology is designed to treat something acutely, right? Falsely compounded pharmaceuticals are going to mask symptoms. If we can address the underlying cause of the migraine and deal with the point of origin in the first place, which is inflammation, then you never got a migraine in the first place. Many, if not most of our patients, they experience relief, then they start to see a lowering frequency of migraines, and then eventually they'll see them go away altogether.
So this is a question from someone who gets migraines and she has to take the day off of work every time she gets a migraine. Will she also have to take a day off of work if she uses cannabis oil?
Well, hopefully no. In most cases, many cases, but definitely most cases, greater than half the time, a patient will be able to take high doses of CBD and a low dose of THC to help with the pain, and be able to continue with their day, their routine, their regimen. They'll find themselves with energy, a good disposition. They will have a dramatic reduction in light sensitivity. Nausea will go down, and your cognitive function will remain normal. So yeah, you can go back to work on cannabis oils, absolutely.
And how do I get these medicines?
To ask and answer any more questions or to obtain our medicines at King Harvest, just go ahead and go to kingharvest.org or go ahead and call us at 877-469-4584. Again, this is Lee and Bridget from kingharvest.org. We're here to help you with all of your questions. Happy healing.
Happy healing.
Hi everyone, this is Lee from King Harvest and kingharvest.org. I wanted to take a moment and thank you all for watching. If you like this video, please go ahead and subscribe or click on one of the videos to your right. Further, if you have any questions or comments, go ahead and leave them below. You can also visit us at kingharvest.org. Thank you again and happy healing.